Former President Carter was scheduled to have his first treatment just this afternoon.
Okay, let's go ahead and talk more about the Carter case. We're joined by Dr. Jack Way, who's a radiation oncologist with the Community Physician Network. Dr. Way, thank you very much for joining us.
Thanks for having me.
First of all, let's talk about what kind of a treatment process President Carter is going to be going through now.
Yeah, so when we see patients who have cancer that's spread to the brain like this, initially, a lot of times patients will get some form of radiation treatments, and that's largely because tumors in the brain can be very symptomatic, and so you want to treat those first. It's very common to get a short course of radiation, oftentimes even just one treatment that is very effective in terms of controlling the tumors in the brain. And then you move on to systemic therapy, which is essentially trying to treat the tumor everywhere else and in the brain as well, with some sort of treatment that goes everywhere.
And you were talking about immune therapies might be really beneficial in his case.
Yeah, so there's a whole wave of new cancer treatments that have been coming out over the past couple of years, and melanoma has been at the forefront of that. And so one of the very common treatments now that we see for melanoma that's spread from where it initially started are these immune therapies, essentially treatment that teaches the body's own immune system to attack cancer cells.
I think some people might be confused because melanoma is typically associated with skin cancer, but in this case, it has metastasized and spread throughout his body.
Yeah, so that's a common misconception. When you see cancer that's spread to the liver or spread to the brain, it's not necessarily that they have liver cancer or brain cancer. You treat it as if it's the cancer from where it started from. And so this melanoma typically is a skin cancer, almost always, but it is common that melanoma can break off and spread to other parts of the body.
He did say today that he is leaving all this in God's hands. He's a deeply religious man. So he is 90 years old. Let's hope for the best. But realistically, what's ahead for him?
Sure. When cancer is metastatic like this, particularly melanoma is among those, it's generally considered incurable. You're unlikely to clear the body of all the cancer cells, but with these new waves of treatment, we're seeing longer and longer times when tumors respond, patients are free of symptoms and have high quality of life, and we really are seeing very significant improvements in terms of amount of time patients have left with their families and left to enjoy life.
Do you expect him to be active during this process, or will this sort of take the wind right out of his sails?
Yeah, these immune therapies can cause some side effects, but untreated tumor causes a lot of side effects as well, and so it causes a lot of symptoms. And so on the aggregate of things, most patients seem to do well with these treatments.
One more quick question. Early diagnosis obviously is key to any type of recovery. What kind of symptoms would a patient be looking at for brain cancer?
Yeah, so again, if the tumor spreads to the brain, you can get headaches, you can get nausea, visual changes, personality changes, memory changes, speech changes. That's fairly common, but again, this is largely melanoma that's spread to the brain and not brain cancer in and of itself.
All right, Dr. Way, thank you so much for being with us tonight. It's very nice.
Thanks for having me.
All right.